everyone. You're watching News Epicenter with me, Maria Shakil. As the world continues to battle the pandemic, we are far away from the numbers of the second wave, but we are not out of the woods yet. Currently, the COVID epicenters are Kerala and Maharashtra, but Kerala is raising alarms as it is contributing 50% of the daily caseload. It has reported over 20,000 cases every day in the past few days, and a central committee of epidemiologists and experts will be visiting the state to review the situation and aid the health department. Now, as per the fourth serosurvey, 67% of the country has been exposed to the virus ever since the first case. But just 44% of Kerala's population above the age of 6 has been infected with the coronavirus, which means a much larger proportion of the population in the state is still susceptible to the disease as compared to many other states. Maharashtra, the state with the highest case count in the country, also has a relatively low disease prevalence. The data shows that about 58% of Maharashtra's population has been so far infected. The serosurvey shows that the disease prevalence was the highest in Madhya Pradesh, where about 79% of the population could have already been infected. This number was 76.2% in Rajasthan, 76% in Bihar and 71% in Uttar Pradesh. Given the fewer number of people who can potentially be infected, explains the slowdown in the cases in these states, among other factors. Nationally, over 3.1 crore positive cases have been detected. But given the serosurvey data, this means that at least 80 crore people have been so far infected with the virus. The centre has asked all the states and union territories to conduct more such surveys in consultation with the ICMR to generate district level data on disease prevalence. The Health Ministry says it is essential in formulating localized public health response measures. So what do the latest findings mean for the days and weeks ahead? How should we read the COVID curve? Are we closer to any form of herd immunity, and do we have a handle on the third wave now? Joining me on the show, K. Sujata Rao is the former Health Secretary. Dr. Anish T.S. is the member of COVID-19 Kerala Experts Committee. Dr. Jaleel Parker is senior pulmonologist. We have Dr. Ravinder Mehta. He is the chief of critical care, pulmonologist also at Apollo Hospitals in Bengaluru. Dr. Anish, I'm going to begin with you. Kerala at 44% and Maharashtra at 58%. Both these states were carrying the highest caseload during the second wave, yet they have the least people with antibodies. What really explains this?
Actually, the level of antibodies or the presence of antibodies may be because of two reasons. One is because of the infection, and other is because of vaccination. If you go for details of vaccination, you will see that in Kerala population, for the first vaccination, it has covered more than 40%, more than that of the country's average. For two doses of vaccination, it is somewhere around additional 25% compared to the country's average. That means the reduction in the seroprevalence is not because of lack of vaccination. Actually, Kerala is a population or a state which has got vaccines higher in proportion compared to the country's average. Then why this is? Because Kerala was able to contain the disease and the disease was not prevalent in Kerala. That may be the reason that our hospitals were not flooded and we were not severely affected by COVID-19 at the peak of second wave. That is very evident compared to some other part of the nation that Kerala was never facing that kind of a calamity.
But then you also have the highest number of vulnerable population.
Definitely. Then you just look at things like this. When COVID-19 is coming to your locality, 100% of people are vulnerable. How can we stop this vulnerability or eliminate this vulnerability? One thing is you allow the infections to happen so that the vulnerability will be lost because all of them are infected. The second one is you keep yourself or your population safe and you reduce the vulnerability by giving vaccination. So Kerala is actually a successful model for like that. For even after maybe 1.5 or 1.75 years of the outbreak, Kerala is able to keep a significant number of its population not infected. So we have to pay for the population that we have to get vaccination.
Whether Kerala model is a successful or not, we'll discuss that later in the show. I'll bring in Dr. Jaleel Parker. Jaleel Parker, look at other aspects of this sero survey. Madhya Pradesh, for example, has the highest sero prevalence or sero positivity at 79%, followed by Rajasthan at 76.2% and then Bihar at 75.9%. These states were also among those where the peak was much later. These were also the states where repeated questions were asked about whether there was testing enough, and then they have more people who have more antibodies. I'm trying to decode the entire sero survey because, it is giving pictures which is very, very confusing.
What has happened is that we have mixed up different aspects of COVID all together, and we are trying to sum up and find as to why it is so. One has to understand that people getting infected is one issue, vaccination is another issue, and the third is the hospitalizations of moderate and severe cases is another issue. What has happened is that because we have lagged into our vaccination, people have become more and more exposed to this virus and have become positive. Vaccination, if it is robust, then you will not have hospitalizations. So your hospitalization and the stress on the healthcare system would be dramatically reduced. And the last is that the medicines that are available, we have actually, confused everybody by flip-flopping on the modality of treatment of COVID right from 1.5 years. Today we are left only with this combination which has come in, which is called the cocktail. Other than that, we have blamed remdesivir, we have blamed tocilizumab, steroids, plasma, etc., etc. So unless you compartmentalize this, you will not be able to give your analysis. Vaccination has to continue. Exposure is going to happen.
Since you are talking specifically about vaccination, Dr. Parker, I'll take that question to Sujata Rao. Ma'am, of the 67.6% who had antibodies overall, 62% were not vaccinated. What does it actually mean? I mean, do we have clarity about those with natural exposure and those with vaccine-mediated antibodies?
My understanding is that, remember that 85% of the COVID infected are asymptomatic. So there could be, it's possible that the infection has spread to a much larger number, and you also are seeing the amount of undercounting, extrapolating the serosurveillance data itself. The underreporting is by a huge margin in many of the northern states. So you can't just simply take the data of the government that is being given of what is the infected lot. So it is possible that a larger cohort of people have been infected and they have antibodies thereby. But the vaccinated part of it and these infections, I think we still have a lot of unknowns insofar as COVID infection is concerned. And what do I mean by that? Yes, the Times of India had come up with a report where they said that both for Pfizer and AstraZeneca, the immunity level, the antibodies were falling rapidly after 6 weeks. So if the duration of antibodies inside the body after vaccination is, say, 6 weeks or 8 weeks, I mean, we have to study our own data, of course, but I'm just taking the Times of India report of what they have done in the US and UK, then that means even those who are vaccinated could be once again vulnerable to this infection if they have taken these vaccinations about 8 weeks ago. So, there is no getting away from the fact that whichever way you look, vaccination is a must. It's a great protection, but it's partial. And there's no getting away from the fact that we have to have distancing and wearing masks and COVID-appropriate behavior. Kerala's case, Kerala continues to be a model in the sense that they're able to identify, because of its aggressive testing policy, their rate of identifying the COVID infected out of the tested is much, much higher than UP or Bihar. I mean, low numbers in UP and Bihar doesn't mean that they're doing well. We know nothing. That's what it means.
Okay. And there have been cases of under-reporting is what Sujata Rao is talking about. Dr. Mehta, that specific logic about lowest seropositivity makes Kerala a better performer in certain, parameters than Assam, which has the second lowest seropositivity, but cases are almost 1/10 of Kerala. What explains that? And at the same time, Assam is at par with Kerala as far as testing is concerned.
So I think this complex math doesn't make sense, and your queries are very justified because we are equating seropositivity and infection as being an index of what is happening right now. The fundamental thing right now is that seropositivity is just a tool to tell you that what is the population which either got infected or vaccinated. That's it. That's all it's telling us. So in Kerala, for example, if it's a low seropositivity, you have to look at the component of either one of them, as you were trying to point out, which is very difficult to talk about. Now, Assam, we know that in the second wave did not have a lot of infection. So it's possible that the low seropositivity of Assam is because native COVID infection did not happen in so many people. So that's one part of it. So taking a survey, taking that number, putting it into perspective from the point of view of why so much and why not so much is not going to be easy. I think it won't help us a lot, except for the fact that so many people are seropositive, so many people are okay either vaccination or COVID wise, and we have to deal with that. Now, the second question of why Kerala's numbers are rising is an interesting and intriguing one, basically. Is it related to the fact that people are mobile more? Is it related to greater testing? Is it related to vaccine not working more in some vulnerable populations? Because we know that vaccine efficacy is being questioned worldwide. Also, is it related to the fact that one vaccine may not be as good as two, and so on? So many of these factors may be playing a role which need to be dissected. So I think if you put everything into context, you won't be able to compare apples and oranges. Each state has to come up with its own issues so as to try and keep COVID at least under control from the point of view of it, hospitalization and death minimalistically.
Yes, while you are emphasizing on the fact that there has to be more vaccines or vaccination drive, which has to be, perhaps increased. Sujata Rao, while we look at various models, and of course this is a complex maths, as Dr. Mehta was rightly pointing out, we'll be able to deduce certain things and make our own interpretation. There have been multiple articles that have been written over the last 24 to 48 hours as well. But having antibodies certainly reduces the chances of infection again. But then here are certain states where vaccination drive has also not been above average, and still their positivity is very, very high.
Without vaccination and the positivity is very high?
Yes.
Well, obviously, because that means there have been more infections over there, and there is infection is carrying on.
But then, ma'am, these were not the states which reported high caseload like Maharashtra and Kerala did in the second wave.
Yeah, but the vaccination, I mean, there's a much larger cohort of people who were unaffected in the initial stages. After all, even the vaccination is much comparatively higher when you compare to the rest of the country. But it's not yet reached the herd immunity level, if we do believe in that concept, isn't it? It is still something like 44%. And even when Kerala was the first state which did zero surveillance in February itself, of the state, and district-wise some data they have, it was a good sample, and that itself showed that 18 to 44-year-olds had 11% positivity, and above 45 also had 11% positivity rate. So, it's a steady plateau that's continuing, and it only shows that vaccination has certainly reduced hospitalization, mortality. It doesn't necessarily mean the transmission of the infection is stopped altogether just because you've done vaccination. That is no vaccination at all. So in Kerala, the more number of people who get antibody infections and have antibodies, possibly they'll reach a level where, at a point, then the positivity will begin to come down, because they won't have enough, the infection won't have, the virus won't have enough people to infect, because everybody would have had antibodies.
Yes, so, but ma'am, again here is the state which reported the first coronavirus state, report, in the country. So they were able to detect it then. Dr. Anish, Kerala in May was reporting over 43,000 new cases every day. This number, in fact, started declining from mid-May 2021 to first week of June. However, from third week of June, again, we are seeing daily new cases in Kerala have been gradually and consistently rising. Kerala is now reporting more than 22,000 new cases every day. This is more than 50% of the peak witnessed by Kerala in mid-May 2021. That means there is something going wrong there. While we discuss the Kerala model, there is this aspect which needs equal attention.
I don't think something is going wrong, but something is happening that is challenging. If you look at the first wave also, you will see the same pattern. When we were at the peak of first wave, somewhere around in September, Kerala was reporting only 10%. The Indian cases were 96,000 per day, but Kerala was reporting only 9,000. Similarly, at the peak of second wave also, in all India, pan-India situation where somewhere around 4,16,000 cases per day, Kerala was reporting somewhere around 40,000, again 10%. But when the national averages are coming down, Kerala still report larger number of cases. That is the pattern that state has got during the entire course of the COVID pandemic. That we have to keep it in our mind. Second one is, the Google mobility data is also showing that lockdown was most effective in Kerala. And the ICMR zero prevalence survey is also saying that lockdown might have been more effective in Kerala. That is why lesser number of people were infected. According to the
but then how is it that in the last 8 weeks, the weekly positivity trend in Kerala has been between 10.5 to 14.8%, and in the last 8 weeks, the positivity percentage has never declined below 10% in the state?
Yes, I am actually coming to that point. That means, suppose there is something called a herd immunity threshold. That means somewhat level of antibody level should be attained so that the community can go out and interact among others. That is somewhere around 65 to 70%. Because in other states where the 65 to 70% of this zero conversion has taken place, there is not much an issue. But you look at Kerala, it is only 44%. And our lockdowns are released and people are going out and they are interacting with each other. And as we are more susceptible population is there in our community, definitely there is a chance of getting a disease. So this is actually happening, but we have to keep it in our mind that suppose these 20,000 cases that is happening every day, if it might have happened in May or April, it might have contributed to the larger number, as you have said, that was 45,000.
Okay.
45,000 plus 20,000, it is somewhere around 65,000. And we cannot afford that much number of cases.
Okay, so then in that case,
we are postponing.
Okay, so in that case, Dr. Jaleel Parker, are we near the threshold of herd immunity, and do we have any picture of the third wave?
Ma'am, my bone of contention is, and I'm sure everyone will rationalize what I'm saying, is that the data that is being collected, the data that is being analyzed, and the data that is being released, I think we are erring somewhere, and that is why you have all these contrasting opinions and discussions. Had our data collection, analyzation, and the result, had it been robust, I don't think we would have undergone all these discussions whatsoever at all. Now, if you're talking about the third wave, it doesn't matter whether the third wave is going to come or the fourth wave is going to come or the fifth wave is going to come. We have to learn to live with COVID. And this is not going to go in 6 months or a year. Please understand, it might take 2 years for it to completely die its own death, maybe 3 years down the road. So we should lay more stress on vaccination,
and management.
Number two is the medication that you are going to bring in as the wonder drug to treat COVID-19. Number three, to see to it that the economy does not go into pits. Because if the economy is going to go into the pits, I'm sure we are heading for trouble. So we have to lay stress on these three issues. That is vaccination, to follow the COVID norms. Yes, of course, lockdowns are not going to help. We are going to we have to live with COVID-19 for the years to come. It will take its own death.
Okay.
And to find a wonder drug,
Okay.
which we do not have as
yes,
yet.
2 years and no wonder drug as of now. I'll give the final words to K. Sujata Rao. But before that, Dr. Mehta, how do the next few weeks and months look like?
Well, so it's very concerning. I mean, and to add to your prior discussion, if I can just put a wild card into the thing, if you look at UK's numbers, 50,000 cases when they hit, they realize that most of them are just mild symptomatic infections or asymptomatic infections. They were not reaching hospitals. So similarly, though we're looking at serosurveys as an index of immunity, if the numbers rise and they're not hitting the hospitals, probably indicates that the vaccine is doing something, one. And two, very few vaccines prevent infection spread. Let us not forget this fact. Very few vaccines prevent infection spread. The Delta variant is known to escape the vaccines. So numbers do not mean much if not put into the big picture of morbidity and hospitalization. So if we go that, we'll be more comforted. In terms of what the next few months look like, well, that's a lovely question. The crystal ball is all murky at this point. Clearly, we do expect a third wave, but we also do hope that between all what we know in terms of the variants, the vaccination, and as was mentioned, new drugs coming, hopefully we should have a muted form where infections, as we said, don't translate into morbidity and hospitalization. If we can do that, then ongoing research, vaccination, whatever the case may be with boosters and all, should at least help us to live with and hopefully surmount the disease in the next finite amount of time.
The final words to you, Sujata Rao, and the question of course here is that, you know, it is almost like a crystal ball gazing, as you know, as one would say, because we really do not know much of the virus, and this virus tends to surprise us in multiple ways. The government is emphasizing that there has to be increased serosurvey. This is the 4th nationwide serosurvey. Similar surveys should be held in perhaps every state, every district to get the right picture. Do you think that is certainly needed to have very contained strategies? Because as we saw in the first wave, when it was a nationwide lockdown, during the second wave, emphasis was on containment zones, localized containment zones, and that could be the only way forward going ahead. You cannot lock down the entire country.
Look, right from the beginning, I've been very, very wary and against lockdown as a policy for public health of infectious disease containment. Having said that, you know, serosurveillance is your only way in which you keep a vigil over an infectious disease spread. Where, how, when, how it is circulating and so on. And we have delayed very badly these 4. Even this last one is a very small sample in my opinion. So, you know, we ought to do district-wise. I see an advisory has gone that district-wise it is done. By now, we should have ramped up enough capability and capacity to get district level granular data and constantly keep a vigil on where is it rising and ebbing, number one. And somebody doing the genome sequencing to see that there's no hidden variant coming in and causing the surprise to us again and disrupting life, and keeping a watch on that and keeping a watch on hospitalization. For example, Telangana is nowhere in your radar of concern, but I'm getting worried because in Hyderabad, I know how the hospitals are getting, once again, private hospitals are getting once again filled up with COVID beds. So something is going on, which is not getting captured, you know. So I think there are certain indicators that we ought to be very, very wary of, not be worried about the number of infections. I don't care whether they're 10 or 20 or 25,000, it doesn't matter. As long as it is within the coping system of the health system, no hospitalization, no deaths, and the variants, the genome sequencing is keeping a tab, and it is just flat.
30 seconds is all I have for you, Dr. Jaleel Parker.
Thank you so much.
I think I agree with most of my panelists what they are speaking about, but at the end of the day, I'm coming back to the same thing, that please vaccinate as early as possible. Someone earlier said so, and I totally agree that when we have an election, how can we reach each and nook and corner of this country to get the votes? The same machinery, it's a very well-oiled machinery, should be used to get your data, to get vaccination, serosurvey, whatever you want to call it. So let's get all these things going. Only then I think we can get over COVID. And of
Yes.
course, the economy has to be robust.
Thank
These
you so
lockdowns
much.
are not going to help.
Dr.
Thank
Jalil
you.
Parker, Sujata Rao, Dr. Anish and Dr. Ravindra Mehta, of course, thank you so much. The government says that there should be more sero-surveys and they should be more localized in terms of getting the right picture from each and every district of India. And that is the only shield that we have, of course, besides the vaccines. So get yourself vaccinated. That's all from me. Thanks so much for watching.